Welcome to the 90-Day Men's Health Challenge information webinar. We believe that the only solution is to get healthier. Your journey guides for this information that we're about to share with you is Dr. Kevin Billups and myself, Tony Holt. Let me tell you just a little bit about Dr. Kevin Billups before you hear him speak today. One is that he is more than qualified to deliver the information you are about to hear. Men's health has been his life's work. The second thing is he absolutely loves helping people. It is his passion and his purpose. And the third thing I want you to know is he has a lot of fun. He makes some of the hardest subjects around men's health and health in general fun and easy to understand. He breaks it down to where people really get it. So what I want to do is introduce to you my friend, my doctor, and my partner, Dr. Kevin Billups.
Thank you, Tony, and welcome everybody. I'm looking forward to sharing this information. Let me just give you a little bit of information about myself, really more of my personal story. A lot of the conditions that we're going to talk to you about tonight, the chronic health conditions that we'll mention, I just want you to know that I was that guy 8 to 10 years ago. You know, I had reached a point in my career where I was busy, but I had put on a lot of weight. I was tired, you know, just really stressed out. I finally kind of went in and got checked out, and my blood pressure was up, my cholesterol was up. I was what we call pre-diabetic. I wasn't sleeping well. And like most men, honestly, I just ignored this, tried to put it off, hope it would go away. And fortunately for me, I had a friend of mine who, pulled me aside and said, you really need to come to this lifestyle program that I'm putting on and listen to the information. And so I finally went and listened, not only to medical doctors, but to members from the general public talk about some of the lifestyle changes that we're going to talk to you about. And I told myself, I said, I can't ignore this anymore. So I just jumped in cold turkey. I decided I'm going to try this. I was very skeptical. I was thinking that this wouldn't work. And, I tell you, to make a long story short, within about 4 or 5 months, I had dropped somewhere about 40 pounds. I was feeling better. Energy level was high. All of my medical conditions went away. My blood pressure normalized, my cholesterol normalized. I was no longer a pre-diabetic, just felt a lot better on this, what I call a plant-rich lifestyle. And so probably the best testimony I can give for myself, besides the personal experience, is that it's just changed the way that I practice medicine. So I really use this as a way for that I approach medicine now. So I'm really happy to share this information. Let's talk a little bit about what I call the real pandemic. These are 4 conditions that you all are quite familiar with. If you look at diabetes or pre-diabetes, so 50% of US adults are affected. So that means that of the people listening to this, the people in your household or your family, 50% of you all have diabetes or pre-diabetes. 50% of you all have hypertension. If you look at being overweight or obese, that's 75% of US adults. So 75% or 3/4 of everyone listening to this is overweight or obese. And then if you look at high cholesterol, that's about 40% of those of us listening. And that's probably a little bit of an underestimate. But here's some good news, or kind of a take-home message that I want to leave you with, is that all of these conditions are directly related to nutrition and lifestyle. So the good news, the positive news, is that we have it with our own ability to change these conditions. It's just that we really have to have the mindset and the desire to do this. Now, you don't, for the conditions, that's not really what men notice. What we notice are symptoms. So if you look at these different symptoms here, these are why men come in to see me in the office. And these are the most common symptoms that I see. I talked about low energy and being tired. I talked about weight gain. We see a lot of arthritis, gout. You can look at having depression, depressed mood, and anxiety. Urinary symptoms, certainly very common in men. reflux, and then a number of sleep issues, including snoring or just insomnia, just not getting enough sleep or lack of sleep. But I want to just talk a few minutes about erectile dysfunction. You know, when you look at that, the erectile dysfunction is an important symptom, and it's often ignored, as we do with many symptoms. But the message I want to leave you with is erectile dysfunction is often an early marker for being at increased risk for what we call cardiovascular or vascular disease. So if you look at men between age 40 and 49, if you have erectile dysfunction, that's difficulty getting or keeping a firm erection. If you have erectile dysfunction between age 40 and 49, you are at 50-fold increased risk of having a heart attack or a stroke than a man who does not have erectile dysfunction. 50-fold increased risk. So these symptoms are really like our body's check engine light. So, you know, we take care of our cars, right? But these are warning signs from your body. So these are things we need to pay attention to. And all of these symptoms and conditions that I just mentioned, they're all related to something called metabolic health. And people think metabolic health is a fancy term. It really isn't. Metabolic health consists of four things. I call them the four pillars of metabolic health. What's your blood sugar? What's your waist size? What's your blood pressure? What's your cholesterol? And the waist size has to be measured at the belly button, not your pant size. It's at your belly button. It's that abdominal fat that is really the troublemaker. And this is important because 88% of men have at least one of these pillars that's abnormal. And the reality of it is, by the time I see you in the office, usually most of the men I see have 3 to 4 of these that are abnormal. I mean, I'm looking back and you know, I myself had all 4 of these that were abnormal by the time I decided to go in and do something about it. So very common, very important in terms of looking at these. I'm going to turn this over now to Tony. I'm going to let Tony tell you his story. I'll just tell you that I've known Tony for about 7 years. We've been working together on this. I can tell you that he is passionate about the lifestyle things that he's going to talk to you about. And I will let him tell you his story. And I will turn you over now to my friend and partner in this lifestyle movement that we're creating, Tony. So Tony, take it away.
Thank you, Dr. Billups. Powerful information you just shared. Really, I'm in the same exact situation. I was in that same situation that you were in, Dr. Billups. I had all of those same symptoms. You know, I found myself over my journey to being unhealthy. It started with something really simple. It started with me walking in around age 25 to the doctor, and the doctor says, "Hey, Tony, we think your blood pressure is a little high." And they put me on a little medication to bring it down. The next thing you know, around age 30, they said, "Hey, we think your cholesterol is a little high." Another medication. The next thing you know, around age 35, we think you're pre-diabetic. And you know the routine. And about age 40, all of a sudden, they said, "We think you have congestive heart failure." So they take me in and they do this procedure called a cardiac catheterization, where they go through a large vein in your leg up to your heart. And if they find any blockage, they will either put a stent in or angioplasty. I just was blessed and fortunate where they didn't find anything, but I still had the condition. And then around age 43 or so, I got the diagnosis of the big C, prostate cancer. You have prostate cancer. So here's what I want you to understand. On the way, I went from up to about 265 pounds. I'm 6'3.5", and I'm 58 years old. So over from 25 until 58, you think about it, 25 until 43, I was just compounding my situations, not dealing with the fact that I wasn't changing any lifestyle, making any type of changes that would actually potentially impact my health. And then all of a sudden, I had an intervention. Someone told me that I could get healthier if I changed my lifestyle and started changing my nutrition and my habits. So the picture on the left is me on my way to 265. The one in the middle is me after losing about 40 pounds. And then the one on the right-hand side is actually me about to run my first full marathon, from congestive heart failure to running a full marathon. And I'm standing in front of a wall, and they ask you, what are you running for? 30,000 people right on the wall. I said I was running for two things. One, for a friend of mine who died doing the very thing he loved to do, that was running. The second thing is I was running for all the people who thought they couldn't do it. So I say to you that it's possible to lose 60 pounds, be disease-free and medication-free, and gain your life back should you choose to. It was possible for me. That was my journey, and I just want to share that with you. So the 90-day challenge that Dr. Billups and I were talking about is really around the following components. So it's about mindset, it's about medical knowledge, nutritional knowledge, movement and sleep, and practicing what we call self-care. When we talk about mindset, what we mean is understanding that desire is the starting point of all achievement, and that the focus for each person who says they want to join this challenge is they recognize that they want to see themselves at the end, at the finish line. And whatever that finish line looks like for you, that you're committed to seeing it through. When we talk about medical knowledge and nutritional knowledge, we want to link lifestyle to chronic health conditions, and we want to share evidence that shows you how to actually use nutrition and that medical knowledge to change your health issues and chronic health conditions. Our focus is really on you healing from the inside out. And we know that movement and sleep is critical to our overall wellness. It is going to help us to combat these chronic health conditions and help us to control our weight. We say practicing self-care. What we mean by that is simply this. When you get on the airplane, the flight attendant says, in case of a drop in cabin pressure, 4 masks will drop from the compartment above. Put your mask on first and then help the person next to you. What that means is not a selfish comment or statement. It is simply this. You are not able to help the person next to you if you're incapacitated. So what we want is for you to be healthy so that you are able to help other people. This process is about self-selection. Each of us have the power to choose. Initially, Dr. Billups and myself chose an easy pathway. We saw some symptoms, some signs. We were ignoring the real issues, and all of a sudden they just kept compounding. And we were then looking for a fix, a quick fix. And when you think about it, there's no quick fix to these types of problems, because symptoms are the precursor to the real issues that will end up taking us out of here. But the effective pathway is really recognizing the symptoms are truly warning signs. They're the green light, the red light that tells you, or yellow light that tells you some things are really getting ready to happen. And you want to understand how they link to those chronic health conditions that Dr. Billups just talked about. And then you want to find a solution that really deals with the root cause, that helps us to move in a different direction than the path we're continuing to be on. At the end of the day, over 90 days, we want to do 3 things. We want to help you know more in those areas that we talked about: mindset, medical knowledge, nutritional knowledge, and movement and sleep. We want you engaged in the process. We understand that in order for us to actually make transition, we have to be engaged in our own recovery. And then empowerment. Here's what we understand. You have the power already. So you just want to turn it back on so that you're able to do what it is you came to do. We recognize when we're empowered, we act. And that's what the focus is for us. The 90-day Men's Health Challenge really has a few benefits. One is, as we've been talking, it's a medical and nutritional integrated approach. So we use evidence, hard facts, to show how to do the things that we are going to share with you in order for you to change your health outcomes. And then a supportive online community. It's a group of men working together in order to make the shift that you want to that you want to see happen. And we have weekly sessions where we have coaching and accountability sessions. They're virtual, they're online. There are several guys that have gone through the challenges with Dr. Billups and I, and their coaches along with Dr. Billups and I, helping you to understand how to achieve the success you want to achieve. We do weekly training sessions on all of the areas that Dr. Billups and I talked about. We have online food demonstrations, and we think that's powerful. So we want to show you how to make these types of nutritional meals that you will actually be able to shift your health by making those types of changes nutritionally. And then also access to online tools and resources.
So I want to go over one of our past participants, Ken York. And Ken has given us permission to talk about his history. So, and really a great history. So the first thing I'll mention is that Ken really noticed how his mindset changed, and even says, mindset is everything. Ken had a number of the conditions that we were talking about, the metabolic health conditions. He had diabetes, high blood pressure, high cholesterol, and he was also overweight. And so he was really most concerned about his blood sugar level, or with his diabetes. Over the course of 90 days, he lost over 30 pounds. He took about 6 inches off of his waist. If you looked at his nutritional habits really changed. He used to say he thinks about food differently now. He approaches food differently. And his what he was most proud of was, if you talk about his blood sugar. So he was diabetic, and his blood sugars would run somewhere in the mornings in the 220s, so running high. And actually, he had these where they were under 100, well under 100 by the end of the challenge. So much so that he was actually able to get off of his high blood pressure medicine, and he was able to cut his diabetic medicine in half. He had great energy. He just felt better. As he said, he just felt lousy before, and he felt great afterwards. And you can look at the before and after picture, right? A picture's worth 1,000 words. And look at his before and after. You can visually see the difference around the waist, and also the difference in his face. And what I'll say is, these results are not atypical. I mean, we see this all the time. And as I mentioned to you earlier, this has changed the way I approach medicine, because I've seen the power in these lifestyle changes. So just a great story from Ken York. Now, is this challenge for you? Well, this is all about self-selection. And I say this all the time to the men when I see them in my office, that really they have to be of the mindset that they're ready to do something about this. So self-selection is important. So is a challenge for you? Well, are you ready to improve or take control of your health? That's part of that self-selection mindset. Do you have one or more chronic health conditions? And remember the metabolic health slide, is 88% of men will have at least one of those 4 problems, and over 60% will have at least 3. Will you benefit from losing weight? And we really focus on the 4 pillars, and knowing that if you take care of those problems, that the weight loss will come. But losing weight is important. And then also, are you ready for a marathon, not a sprint? This is a lifestyle change. This isn't a diet. So this isn't a quick fix. The effective pathway is really a lifestyle commitment, more of a marathon. And then finally, are you ready to take action now?
If you are a certificate employee with Metro Nashville Public Schools, And the cost of this program to you is zero. So Metro Nashville Public Schools has actually picked up the cost for this program for you. So you're able to join us on the journey to restorative health for no money out of your pocket, and the results belong to you.
So let me finish up talking about what I call the COI, or the cost of inaction. You know, I've said a lot on, and my thought is it's really time for men. It's time for us to get serious about our health. And you know, what's the cost of not acting? Well, there are a couple of things. One cost is that you're going to end up with those chronic conditions I talked about. You're going to end up developing diabetes, high blood pressure. You end up having high cholesterol, and all these are linked to problems with your metabolic health, and they can lead to really adverse outcomes. They can lead to having a heart attack. They can lead to having a stroke. They can lead to a number of medical problems. So, in terms of the cost to your family, you know, what's the cost of having a heart attack or a stroke and becoming both a financial and an emotional burden on your family? What's the cost of premature death? You know, so where you're taken away from your family in the prime of your life, but also that's going to cause additional hardships from them. I also see a lot of men who suffer from chronic depression, chronic stress, chronic anxiety, all over these issues that really could be prevented and addressed with lifestyle. So I see a lot of that, and then finally, I'll just say the good news. I'll end on a positive note is we really do have it within our own capability to address this. So leading, you know, action, we said empowerment act, by acting, you really can address this, and it doesn't have to be these negative outcomes that we've talked about.
So as we close, the time to take action is really right now. So if this is for you, we want you to go ahead and join us on this journey. If anything that Dr. Billups and I have said today makes any sense to you, then act now. Because what we recognize is if you're not acting now, then when? And if it's not this, then what? And so make a decision about your health and that you're ready to choose an effective pathway versus an easy pathway. So the QR code that you see, if you take your phone out right now and point it at that QR code with your camera, you'll go directly to the site to enroll and get started with us. Otherwise, use the website that you see in front of you, projecthealth500.com, www.projecthealth500.com, to join us on the journey. With that being said, God bless, and we'll see you at the top.